Hello, I'm Tony DeMaria, the editor of JACC, here with the highlights of the December 25th issue. TAVR, or transcatheter aortic valve replacement, is clearly one of the hottest topics in cardiology, and the PARTNER trial was the major randomized controlled trial that compared TAVR to conventional surgical aortic valve replacements in patients who were either not a candidate for surgery or high risk. And in this issue of JACC, we have the cost-effective analysis of PARTNER A. That is a comparison between TAVR and surgical aortic valve replacement in high-risk patients. And these investigators carefully looked both at cost and survival and quality of life, and it was over the 12-month period of the study. And what they found overall was that the cost effectiveness of TAVR and surgical aortic valve replacement were essentially equal. There was no difference. However, upon sub-analysis, what they showed was a clear increased cost effectiveness of TAVR done through the femoral access approach as compared to the transapical approach. And in fact, for a transcatheter aortic valve replacement done by the femoral route, the cost savings were quite effective, and in 70% of those patients, the cost per QALY was less than $50,000, which has been the generally accepted criteria for something that is cost effective enough to be reimbursed. Now, of interest, they allotted $30,000 for the cost of the TAVR valve as compared to just over $5,000 for the surgical valve. So there's quite a bit of difference there. What we can conclude, I think, however, is that TAVR certainly, when done through the femoral route, is cost effective as compared to surgery. Apically, it is not quite as cost effective, and so there will be a continuing push to develop transfemoral techniques to enable TAVR to be done. Significant ventricular arrhythmias following coronary artery bypass graft surgery are relatively uncommon. And so there's not much written about this, and in fact, to study this uncommon condition, one needs a very large database. And in this issue of JACC, we have just such a study, and investigators from Emory University went to the SDS database and extracted their own data on over 14,000 patients who underwent CABG, and they defined ventricular arrhythmias as either sustained ventricular tachycardia lasting over 30 seconds or ventricular fibrillation. And they found the incidence of ventricular arrhythmias of this nature was actually quite small, less than 2%, about 1.6% in the first 30 days following CABG, again confirming the uncommon prevalence of ventricular arrhythmias following CABG. They found, not surprisingly, almost predictably, that these arrhythmias were more common in older patients, in patients with impaired left ventricular function, and in patients who had major comorbidities. Of perhaps greatest interest, a patient who experienced one of these arrhythmias in the first 30 days post-op after CABG had a significantly increased risk of mortality, about a 2.5 increase in hazard for mortality over a 3.5-year follow-up. So some contemporary data on the prevalence and significance of ventricular arrhythmias following bypass surgery. One of the burning issues in cardiology is how soon in life to begin statin therapy to reduce the risk of coronary heart disease. And one way to get evidence for this is to look at individuals who are born with mutations, single nucleotide polymorphisms that result in a low LDL level at birth, and then to see how their risk is reduced throughout life. And in a somewhat statistically complex analysis, investigators in this issue looked at individuals who had 9 different mutations of 6 different genes, each of which resulted in a low LDL level at birth. And then they did a series of meta-analyses to determine how much risk was reduced in these individuals per unit of reduced LDL. And what they found was really interesting. Bottom line, they found that for an equivalent LDL level produced in an adult by statins, that one would have a 3-fold greater reduction in coronary heart disease events had that same level of LDL been produced younger in life and preferably at birth. So this is important information. There's other data with other mutations that have suggested the same thing. Important information that the sooner LDL level is reduced, the greater the reduction of coronary heart disease. So points to the importance of a really hygienic lifestyle in childhood. So we have some clinically relevant information in this issue of JACC relating to TAVR, relating to ventricular arrhythmias post-CABG, relating to the early point in life at which statin therapy should be initiated. I hope you enjoy reading the entire manuscripts.